Welcome to today's Q&A session. On March 17th, the COPD Foundation hosted the first in a series of webinars on the coronavirus, COVID-19, and COPD. We received over 100 questions. Today, we're joined by Dr. Byron Thomashow, Chief Medical Officer of the COPD Foundation, and Dr. Barbara Yawn, consultant to the COPD Foundation, to answer some of the most common questions we received. Written answers to the full list of questions submitted can now be found on the COPD Foundation website, www.copdfoundation.org. The information discussed today should not serve as a substitute for medical advice and should not be used for medical advice, diagnosis, or treatment. Please consult with your physician before making changes to your own COPD management plan, and if you have any concerns about COVID-19 symptoms. The information presented about COVID-19 was current as of today, Tuesday, March 24th, but the information about the disease and the recommendations discussed are changing rapidly. So with that, I want to thank our experts for joining us today, and let's get started. So we're going to start with questions about how the coronavirus spreads. The first question is for you, Dr. Thomashow. How long can the coronavirus remain stable on different types of surfaces? And can you catch COVID-19 from these surfaces?
Thank you, Jamie. So a lot of work has been done in this area, and I think the most important thing to stress is that even though you may be able to detect or find a virus on a surface, doesn't necessarily mean it will be contagious. The best bet is to wash your hands well after you touch surfaces outside your home, to clean surfaces well. Those will give you some protection. But we do have a little bit more data than we had a couple of weeks ago about how long the virus can be found on various surfaces. With copper, it looks like it's up to 4 hours. With cardboard, it looks like it's up to 24 hours. With plastic and stainless steel, it's up to 2 to 3 days. So potentially the virus can be found on these surfaces for some time, stressing the importance of cleaning your hands well and not touching your face or your mouth with your hands. The one other area that they've found is that with aerosols, it can be up to 3 hours. Now that's really important because aerosols would increase the risk of spread. But it's important to stress from the beginning that this organism does not predominantly spread by aerosols. It spreads by droplet infection, where the range of spread is really only a couple of feet. That's where that 6 feet window of protection comes from. It only gets aerosolized in certain settings, particularly things used in a hospital setting like nebulizers and things like that, and we will talk more about that going on. But it's important to stress that in general, this is not aerosolized.
Great, thank you. Dr. Thomashow, can the virus be spread by touching contaminated surfaces like money and food? How can we avoid catching it if so?
So technically the answer is yes in some cases, but only if you come in contact with a surface that has a stable virus on it and then spreads it to your face. So again, as with the first question, the most important thing is when you touch any of these things, including money, which probably has lots of germs, is to clean your hands well and to avoid touching your face and with your hands. There's no current evidence to suggest that the coronavirus is spread through food, but we do suggest washing fruits and vegetables and avoiding uncooked foods to be on the safe side. And again, the best practice, wash your hands as often as possible and avoid touching your face.
Great, thank you. And Dr. Thomashow, is the virus airborne, and for how long are the droplets active? If so, is it safe to go outside when it's windy?
So again, this organism is generally not aerosolized. It's only aerosolized in certain settings. And so going outside, as long as you're staying away from groups, as long as you've got that 6 foot window between you and others, should be safe. It actually would be good to get outside and get some air and get some exercise, as long as you keep your distance from others. I know that's difficult, but it's something you need to do. The concern over the nebulizers is potentially a real concern. Not so much for the person using the nebulizer, because you either are infected or not infected, and that won't be altered by your use of the nebulizer, but rather by people around you who may not be infected, who potentially could be if the organism is indeed aerosolized by the nebulizer. In many hospitals, including my own, we are clearly limiting the number of nebulizers that are used. There is concern that other things like BiPAP, CPAP machines could nebulize as well, could aerosolize as well. And so you need to be cautious, not so much for the person using them, but for people around them. Safety is important.
Thank you. And Dr. Thomashow, can someone who initially tests negative go on to test positive a few days later? And when would an infected person be most contagious?
So the answer about the contagion is that when someone becomes symptomatic, the likelihood is that they're much more contagious. So it's really when they become symptomatic that the risk gets higher. But there is some evidence suggesting that the disease can be spread even before people become significantly symptomatic. That's a concern, and we don't know how long that window would last, but potentially for a couple of days. So that's one of the concerns when you don't know whether someone is shedding a virus or not. One recent study estimated that someone with mild symptoms could still shed the virus for about 10 days. So it's possible that someone may test positive for a longer time than they are truly contagious. We don't know the answer to some of these questions, but we'll learn more as we go forward. But it's important to understand that most of the risk occurs when you are symptomatic. As far as the test is concerned, I think it's important to stress that we have been lacking good testing. That's a gap that is being corrected now. But what has not gotten a lot of attention is the fact that testing is not a perfect thing. The test, it requires a deep nasal swab. If you do it correctly, it has a very high sensitivity. If it is not done correctly, the sensitivity may be lower. I would suggest at this point in time that especially when these tests become broadly available and not potentially done in a very carefully controlled manner, that the only test that is really helpful is a positive test. Then you pretty much know that you have the infection and can take care. If the test is negative, there is still concern over the false negative rate, and therefore you need to be cautious about interpreting that. And many people would suggest that you still need to remain isolated if there are symptoms or concerns. Barbara, your thoughts on that?
I agree with you completely. And the sensitivity means that if you're positive, the test is going to be positive. Well, it's not quite what it means, but it means you will be identified. And so it's really important, as you said, if you test negative, that's not 100% a statement that you don't have the coronavirus. If you have lots of symptoms, you didn't get the test at one of these specialized testing centers, you still could be infected. So important consideration that not all negative tests should be taken at face value.
Thank you both very much. This question will be for Dr. Yawn. Dr. Yawn, are individuals who have recovered from COVID-19 infection resistant to reinfection or immune to the virus in the future?
That's a great question, and we really don't know yet because it's very early. And yes, there are a few people who have been reported in China to have recovered from the infection and then been tested positive again. Of course, these are just reports. We don't have definite medical data. Maybe they were tested positive, or maybe they were just presumed to be positive in the first place. So we really don't know yet. We do believe if someone has truly had the virus, they're indeed going to have some level of immunity, but we don't know if it's going to be enough to prevent all reinfections.
Thank you. And we have next a question about pets. Can pets carry the virus and transfer it to humans?
Well, right now, according to the World Health Organization and the American Veterinary Medical Association, there is no evidence that pet dogs and cats can get the COVID-19 and can spread it to any other animals or humans. So I don't think there is really a concern. The only thing that we ever think about is, getting it on their fur and then somebody else getting it on their hands from the fur, but we have no evidence of that. So right now, there is no evidence that we should be concerned about our pet cats and dogs.
Thank you. And Dr. Yawn, do we think that the warm weather will stop the virus from spreading?
Well, we'd certainly like to believe that, but remember, this is a new virus. This is not like necessarily the influenza, which, yes, does usually decrease during warm weather, but we don't know enough yet about it. So what we're going to have to do is, unfortunately, we're going to just have to wait and see. We hope it will drop with the warm, sunny weather, but we don't know. There is also, of course, the chance and probably a high likelihood that we're going to have some increase again then in the fall with the colder weather again, just like we do when we have the flu season starting again. So we're going to have to watch, and that's why it's going to be important for continued good hand washing and, protection with all of the good hygiene habits, even if it seems to slow down.
Thank you. At this time, I think we want to shift our gears a little bit and talk about signs, symptoms, and treatment of COVID-19. So, Dr. Yawn, the first question in this section is, does someone who has COVID-19 always get a fever? And if so, is it safe to use over-the-counter medications to reduce the fever?
Good question. About 90% of the people who get COVID-19 will have a fever, and the chances are even higher of having a significant fever, like 102 or greater, in someone who has a serious infection. Now, do you need to treat all fevers? People who have a low fever that really is not that bothersome, like 99.6 or 100 or 100.2 or something, there may be no reason whatsoever to treat this fever. It is not dangerous. It is not going to make the infection worse. In fact, it may help as one of our body's defenses to fight the infection. So low-grade fever, I don't recommend you really treat those. Higher fevers, yes, there can be very uncomfortable and you may want to treat them. Right now, we think the best idea is probably to use acetaminophen. There is some little bit of information that the non-steroidals, anti-inflammatories may not be the best idea. They may have some increased risk for further COVID-19 complications if you use them. So fortunately, we have the acetaminophen that we can use for short periods of time to treat a more higher level of the fever.
Great, thank you. So Dr. Thomashow, will my oxygen levels go down if I get COVID-19?
It's possible. It may not happen. For many patients, for many people, this is a flu-like syndrome, and 80% of them tend to have more mild symptoms. People with COPD who start with lung disease may be a little more prone to have a more severe episode, and so it wouldn't be impossible for the oxygen levels to go down. One of the questions that Barbara and I and others get asked all the time is how to decide whether or not the symptoms you're having represent a normal flare of your COPD or whether they represent the COVID-19. And it can be difficult to tell sometimes because the two most common symptoms of an exacerbation, cough and shortness of breath, also can be seen with COVID-19. So you use other things. As Barbara was saying, you look for fevers, which are not a common feature of an exacerbation, but very common, as Barbara mentioned, with COVID-19. You look for things which are different than your normal exacerbations. GI side effects, which are pretty rare in COPD flares, can occur with COVID-19. The cough with COVID-19 tends to be drier than the cough that you might have with a normal exacerbation. So there are a number of features you look at. The most important thing to recognize is if it's different than your normal flare, And watching your breathing, watching your oxygen levels is an important criteria. And you need to talk with your doctor, hopefully in advance, to say, what are the things that lead me to call you if there's a problem?
Thank you. So, Dr. Thomashow, is the cough associated with COVID-19 a dry cough compared to the wet cough or the phlegmy cough that many with COPD have?
From the data we've seen so far, the cough with COVID-19 tends to be dry. But I think it's important to stress that while certainly those patients with COPD and other lung diseases who caught COVID-19 could have a more complicated course, there were relatively few cases of COPD patients, very little data of COPD patients who have COVID-19. So it's really impossible to tell whether the cough is going to be dramatically different in the setting of someone who classically produces sputum with their cough. I think that's something we'll gauge as we go forward. But the answer is that classically this is a dry cough.
Great, thank you. Now we're going to shift to talking a little bit more about aspects of treatment for people with COPD and COVID-19. So the next question is, Dr. Thomashow, what is the protocol for treating COVID-19 in a COPD patient?
So I think the most important issue, and I think Barbara agrees, is to have a COPD action plan that you're comfortable with, that you've talked to your provider about, and now adding to that plan, what do I do if I have concerns with COVID-19, or what do I do if I think I may have become exposed to or infected with COVID-19? I think these are things that you want to plan in advice. Many of us provide a plan with the patients we take care of, the people we take care of, to provide them a list of things they might want to do. In other words, if an exacerbation is occurring, perhaps there might be a short course of an antibiotic, perhaps there might be a short course of steroid therapy, for example. I think most of us would continue to stress that you need to take your medicines on a regular basis, but all of these things should be talked with your provider in advance, including with your provider when you should make a phone call about questions if you don't understand. I think that's really important. One of the things the COPD Foundation has done in the last week or two is to reach out to our experts on our Medical and Scientific Advisory Council to ask them whether or not the therapy should be altered. The normal exacerbation therapy, the normal approach should be altered in an outpatient who may have been exposed or has COVID-19. And the overwhelming reaction of the experts we discussed, recognizing that there isn't very much data and that this is all expert opinion, was that therapy should be very much the same. That anything that led to you using an antibiotic or a steroid course in another situation should be used or considered to be used in this situation as well. But remember, neither Barbara and I or the people on the call or my experts that we talk to can know how your disease behaves. So the best idea is to talk to your provider, potentially, hopefully in advance, so you have a plan.
Great, thank you. And the next question is, Dr. Thomashow, what type of treatments are being considered for COVID-19?
So recognizing that this is a world filled with terror at the moment, and we all understand that, we all feel the fear and our families feel it as well, it's important for everyone to understand that a tremendous amount of work is being done. And though we all have heard and recognized that vaccines will probably take a year to year and a half, there's a lot of other work that's being done, whether or not they're with potential of using antibodies of people who have gotten through their infection as what we call passive immunity, whether or not they're immune modulators that might help to adjust the immune system in our therapies, whether or not there are antivirals, and there are a number of antivirals that are presently being looked at, or whether or not there are other agents that have already been approved. You all have heard about the chloroquine, hydrochloroquine story as well. I would stress what Dr. Fauci has said. The data we have so far is basically anecdotal. We do not know. These medicines carry potential risk. We need to have a better idea of whether they work and who they work for. At the moment, they are being used as an end hope, if you will, as an outside hope in patients who are desperately ill in the hospital, that we want to make sure we do everything possible. That's where I think most of our efforts presently on, as are the efforts to test this, to review it, to know that who they need to use it, and know it can be safely used. And I would suggest one more thing that Barbara has mentioned to me, and that is there are a number of people who use these drugs chronically for diseases that they need to treat. Well, we have proof that they work. We need to make sure that those people are able to continue to get those medicines. Barbara, do you have a comment on this? It's a really important issue that I think we all feel strongly about.
It is, and I think that the main thing that I like to stress is please don't go ask for a prescription so you can just have these pills at home in case you need them, because there are these people with the other chronic diseases, like lupus, for example, that use the hydrochloroquine on a daily basis and need it to control their chronic disease. So if it's going to be used, I agree. I think it's usually going to be used in the hospital setting, and so you don't need to go get a prescription and have it at home in case.
Because these are available medicines, and therefore we have an idea of what of how they work and how they may help. We should know within a reasonably short period of time whether or not these are really helpful or not. We do not know yet, and as Barbara and I would tell you, these medicines do have potential side effects and need to be clearly discussed with your provider.
Thank you both. This next question, Dr. Yawn, if we have a non-productive cough, should we use over-the-counter cough syrup, and should it be a suppressant or an expectorant?
If you have a cough that is related to the COVID-19, we think that it's going to be a dry cough. So if you're experiencing a dry or non-productive cough, you could use a cough suppressant to maybe provide some relief. But we really don't have any information on this. We don't know how helpful it is. We don't know how well it does suppress cough in patients with COVID-19. But if you feel you'd like to try it, you don't have any other reason you shouldn't be taking it, it might be worth a try for the symptoms.
Thank you. And Dr. Yawn, if I get COVID-19, should I stop irrigating my sinuses to avoid spreading the virus?
Well, I think that's a really good question. It depends, obviously, on your living situation. If you live alone and you're going to obviously clean the area around where you irrigated your sinuses and nobody else is going to be there, then by all means, go right ahead. If you can do this in a place where the people you're living with are unlikely to be exposed to any of the droplets or anything from the nasal irrigation, then okay. Or if this is really important for you to maintain control of chronic symptoms, then probably okay. But remember, you are potentially exposing the people who are in your home with the nasal irrigation solution if it gets on the bathroom counter or the sink or places like that. So you're going to want to make sure that if you do it, you go ahead and clean the area or disinfect it afterwards.
Thank you. And Dr. Yawn, this brings us to another question. Should you use a nebulizer if you contract COVID-19? And why could it increase infection?
Well, that's also a good question and refers back to something that Byron said in the beginning, that if this virus gets aerosolized, it can stay in the air for up to 3 hours or so, and may be much more likely to cause an infection because you're going to inhale this aerosolized. So if you have COVID-19, the nebulizer could aerosolize the virus when you use it. So again, if you live alone and you use it and there's nobody else around for the next 3 hours, then by all means, go right ahead and use it. If there are other people around you, you'd probably want to use your nebulizer in a place where they're not going to be for the next 4 hours because you don't want to expose them. If you can, after an infection is confirmed with the COVID-19, change to some other form of using your same medications, and it works for you, and there's people who are around you, it would probably be a good idea to quit using the nebulizer for the 10 to 14 days and switch to your other type of medication and your other inhalers.
So a follow-up question then. So it would be okay to continue using meter dose inhalers and other handhelds if you get COVID-19?
Absolutely. You want to keep taking your usual medications for your COPD or your asthma or what other respiratory. So you're going to want to continue using your usual inhalers, whether they're MDIs or dry powder inhalers or soft mist inhalers. Yes, you should use those.
Great, thank you. So Dr. Thomashow, continuing with some of the medication questions, should you stop using ACE inhibitors if you have symptoms of COVID-19?
So the issue of ACE inhibitors, drugs which we frequently use for blood pressure or cardiac control, and other medications is currently being evaluated. No one knows some of these answers. I would suggest, and I assume Barbara would agree, not to stop any medication without talking to your doctor. There are obviously potential harms in stopping medicines that you need to be on. So the answer is we don't know yet. Don't stop medicines without talking to your doctor.
Thank you. And also, the next question on medications, can anti-inflammatory medications make COVID-19 symptoms worse?
I don't honestly know the answer to that question. As Barbara was saying before, there is some evidence that's coming out of France that anti-inflammatory drugs used to control fever may complicate the course. Now, whether that's because it somehow infects the inflammatory response or whether or not this is about other systems that might be affected. For example, if you use those medicines in high doses, you could, for example, cause some GI bleeding, or you could affect kidney function. Those things are obviously something you don't want to happen on top of someone who has a serious viral infection. But I don't honestly know whether or not they actually increase symptoms or not.
Okay, thank you. And Dr. Thomashow, should someone with asthma and COPD who is currently on an inhaled corticosteroid continue to take it now? And will they cause complications if they get COVID-19?
So this is also a very important question. What I can tell you is that the GINA guidelines, and GINA is the major asthma guideline group in the world, they have made it very clear that they feel that asthmatics should continue inhaled corticosteroids. Remember, in asthma, inhaled corticosteroids are the mainstay of therapy. So GINA felt very strongly about this. GOLD, which is the major scientific COPD group in the world, in their recent statements released just within the last day or two, basically stated that they are not aware of any scientific evidence to support that inhaled corticosteroids should be avoided in patients with COPD during this COVID-19 epidemic. I think that that's the message you want to take. I think if you're on medicines and they're working, you should continue. I will say that one of the questions that we asked our experts on the COPD Foundation involved inhaled corticosteroids. The issue there, and I think everyone would agree that we need to be cautious about making any changes, and those changes should be evaluated with your physician. But it's important to recognize that in COPD as opposed to asthma, the indication for inhaled corticosteroids is really that of people with frequent exacerbations, frequent flares of their disease. That's the indication which is stronger for inhaled steroid in the COPD world. And so that's something you should certainly talk to your doctors about. But if I have patients at this point in time who are clinically stable on their regimen, I'm not suggesting any changes. We will see if that changes as we go along. But the GOLD and the GINA guidelines are very clear.
Great, thank you. And Dr. Thomashow, will someone with COPD who gets COVID-19 end up needing a ventilator? And if so, what would happen if none are available?
So again, I want to stress what both of us have said earlier, and that is that most patients with COVID-19, if they have an infection, will have a relatively mild disease, sort of like a flu syndrome. That's probably 80% or more of these patients. I actually suspect it's going to be a lot more than 80% because we've probably been missing people who have been pretty much asymptomatic or with very minimal symptoms. It is certainly true that if you have underlying lung problems and you get an infection, that you're more likely to end up being sicker, that you may be more likely to end up in the hospital and potentially have a greater risk of ending on a respirator. But I think it's important to stress that most people, even with COPD, are likely not to need to be in the hospital, that most patients, even with COPD who are hospitalized, are likely not going to end up needing to be in an ICU and not need to be ventilated. And if they do end up need to be ventilated, that doesn't mean they're not going to get better. The whole idea is to get them better. And I understand the fear that's been raised about the fact that we may run out of ventilators. That's an issue that's being addressed. We rebuilt our entire Navy after Pearl Harbor. We can build ventilators and get masks and protective gear for our providers. That's going to happen.
Thank you, Dr. Thomashow. That's reassuring. Thank you so much. And now, Dr. Yawn, this question is for you. In those patients who die from COVID-19, how does that happen? Do the lungs close?
It's a good question, but again, I want to reemphasize what Byron just said, which is that most people, by far, way the majority, up to 98% of people, or even higher percent of people who get COVID-19 are not going to die. Our whole goal is to recognize these infections and get the people therapy that need therapy. Now, there are people who do die, but most of these are people that have serious other conditions, are quite elderly. We're talking the 80s and above. And many of them that die as from complications like pneumonia, or they have multi-organ system failure where it's not just the lungs, it's also the kidneys and the heart that are impacted. And again, those are usually people with pre-existing heart or kidney diseases. So we know that it does cause shortness of breath, but not all of the deaths are due to just lung symptoms. And again, let's remember that most of the people are going to have mild cases. Those that have more serious cases are still unlikely to be in the ICU or to die. Let's talk about preventing the virus and the spread, and how can we keep you healthy?
I agree with everything that Barbara just said. The only thing I want to stress is that there's been a lot of press about how many young people are ignoring this pandemic. It has been stressed so often that most young people are going to be okay with this, that I think that their major concern is bringing it home to their elderly family or friends. And while I understand that, it's important to understand that young people can get sick with this too. Some of them can get seriously sick with this. So while Barbara is certainly correct that the majority are older people with multi-comorbidities, young people are at risk too, and they need to take care here. We're all in this together. They need to be part of the solution.
Yeah, and that's a great point. And when we look at some of the early data, at first we expected that, people from like 20 to 40 were going to be all mild cases and none of them were going to have serious disease. And it turns out that in China, that people from 20 to 40 did sometimes get more ill. And it wasn't just keeping them from spreading it, but also keeping them from being ill. So, yes, no age group should ignore this potential risk.
Thank you. Thank you both. Good points. Dr. Yawn, another question is, do certain medications like regular antibiotic use or prednisone increase the risk that you will contract COVID-19?
Well, that's a complicated question, and the answer is going to vary. For example, people who take prednisone or oral steroids every day in fairly high doses over a long period of time may have some compromise to their immune system, and they're not able to fight off lots of different kinds of infections as well as people who aren't taking the steroids. So that is something that we want to think about if you are taking daily steroids, not the 5 or 10 days that you take for an exacerbation, but every day for long periods of time. So the antibiotics, there really isn't any evidence right now that daily use of antibiotics like azithromycin, which is used commonly daily for COPD, do increase your risk. So it's really important that if you are taking daily steroids or something else like azithromycin and you're concerned, talk to your doctor. They know your specific history and can help you make a decision about those. Right now, we have no reason to believe that most people would have to stop the daily azithromycin and the daily prednisone. You can't just suddenly stop that without having potential risks and side effects. So please talk to your doctor and don't just stop those.
Good points. Thank you so much. And Dr. Yawn, regardless of age, is having COPD on its own considered risk factor for COVID-19? And is it a risk cumulative if you have multiple risk factors?
Well, again, I'm going to go back to the fact that this is a new virus. We really have only been dealing with it for a few months, so we're still learning. We would think that in general, someone who has chronic disease is more likely to have problems if they get any kind of an infection that certainly one that affects the same organs like the lungs. So in general, if your health status is worse, then you may have more severe COPD, and you may have a greater risk of developing some of the complications of COVID if you get infected. We really don't know right now if you're more likely to get the infection. So again, we're watching this, we're trying to get more data, and we're just continuing to urge people to do all the things for prevention, like the good hand washing, the sanitizing and cleaning surfaces. And if you're out and about and you might be touching where the virus is, don't get your hands near your nose or mouth where the virus would get into the body. So good protection is what we're still recommending.
Okay, and Dr. Yawn, I had one more question. Are people with other conditions, such as alpha-1, bronchiectasis, NTM, MAC, or other autoimmune diseases at higher risk for contracting the disease and or developing more severe complications?
Well, again, we have very little data on this. And, we said we didn't have much data on COPD. Well, we have even less data on alpha-1 antitrypsin deficiency and bronchiectasis. However, again, we think that probably people with autoimmune conditions are more likely to have problems if they do get infected. Are they more likely to get infected maybe. So they need to really pay attention to all of the preventive measures we've talked to. Right now, as there really isn't any data about people with NTM or the non-tuberculosis conditions. So we really don't know. We want these people to be aggressive with prevention and talk to their physicians if they have any symptoms, because there may be something their physician is going to recommend they do right away. Again, we don't think there is any reason for them to stop therapy. For example, the people with alpha-1 antitrypsin deficiency, they should not be stopping their augmentation therapy unless their physician specifically recommends that.
Great, thank you, Dr. Yawn. So Dr. Thomashow, this question is about the emergency room. And are patients who go to the emergency room because of the COPD issues at higher risk of contracting COVID-19? And how could we keep them out of the ER?
So it's not just people with COPD who go to the emergency room who are at higher risk. It's everyone. It's the people who work there. It's the people who go there for other medical problems. It's why many hospitals like mine are setting up special areas outside of the emergency room to people who are proven to be positive or at risk of having it, so we can try to limit the exposures. It's one of the reasons, and I think Barbara and I have talked about this, that you should set up with your provider in advance what you should do to maximize your therapies at home if you're having an exacerbation, to try to keep you out of the emergency room, or how to deal with some symptoms if you do have COVID-19. These are plans that you need to work out with your physician in advance. And if it reaches the point, whether it's because of progressive fevers or increasing shortness of breath, where you think it's time to go to the emergency room, it would obviously be helpful if the people with you were to call in advance and let them know that you're coming and potentially have the COVID-19, so they can set things up to be ready for you, as opposed to just setting up in the blank. We're all here to help you, and we want to help you, but I think that that's probably the best way of approaching. This is not the time for people with minimal symptoms of something else to end up in the emergency room if they can avoid it.
Great, thank you. Dr. Thomashow, are patients who have had bilateral lung volume reduction surgery due to emphysema at a higher risk?
Well, if the lung volume reduction surgery or the bronchoscopic lung volume reduction work, their breathing could actually be better than it would have been before. But these are not cures of their disease. They still have underlying emphysema. They still have underlying COPD, and so they're going to be at more risk. But if anything, these therapies, if they work, might give them a little bit more of a protection, because they may have a little bit more reserve. But the emphysema is still the emphysema. They're not being cured by these procedures.
Great, thank you. And one last question to close out the risk section. Should all healthcare workers be tested to ensure patients are not exposed to the virus as they seek care?
I believe, and I think most of us believe, that once testing is available in the amount that we need, that healthcare providers should be one of the groups that's being tested. With this group, I think you can be reasonably certain that the testing will be done well, and therefore that there would be less potential concerns out of a false negative result. Having said that, and I think Barbara stressed this before, if you're symptomatic, even if the test is negative, whether you're a healthcare provider or someone else, I think that the best way to deal with that is to be isolated for a period of time to protect yourself and others. We will work our way through this together.
Great, thank you. So now we're going to shift to talking about preventing COVID-19, and we're going to start with some questions around preventing COVID-19 at home. So Dr. Thomashow, how should we be sanitizing our homes? Many report that bleach or other disinfectants bother breathing. So what can they do to keep homes safe, and is it necessary if they live alone?
Okay, so again, it's hard to know with certainty, but most of the experts suspect that if you do not that you do not need to regularly disinfect your home if you're living alone, not going out and not having others in your home. But good hand washing and keeping your hands away from your face is always a good plan. The CDC recommends routine cleaning of areas in your home that are touched often, counters, doorknobs, etc., with soap and water. If someone at home is sick or you are concerned about shipments coming into the home, your best option is to try to find a sanitizer that does not bother you or affect your breathing. The CDC has a list of suggestions, and the EPA offers suggestions on approved disinfectants. You can find links in the written Q&A answers on the COPD Foundation website. If all options bother you, my suggestion would be to get someone else to clean the area you are concerned about and stay out of the room being cleaned until the odors are gone. This is something that's a lot in the literature that's now being published that you can look at. We do need to keep things clean. And the very fact that this organism can at least be found on countertops for a period of time means that cleaning them is really important.
Thank you so much. Dr. Yawn, I have a question for you. Should I stop my house cleaning service during this time?
Well, the answer is maybe. So we don't know how long the situation is going to last. And, you know, if you have a house cleaning service and the situation lasts months, you probably don't want to stop it for months. But we do advise you to follow some general guidance. If there is someone who comes into your home to do cleaning, I would go to the door, and before I let them in, through the door, I would ask them if they have any symptoms at all, and you can ask them about, you know, GI symptoms and cough and fever. If they have any of those, you thank them and tell them, please don't come in today, go home, don't come back for at least 2 weeks, and if possible, can you send somebody else to do the cleaning instead of you? So I think it's important to know that and make a decision based on that. And if you don't need the cleaning and you can do it yourself, then I would go ahead and do it myself. But if you need help, ask about the health of the person before you let them in to clean.
Good ideas, thank you. And Dr. Yawn, how should I disinfect packages or other deliveries or products that are brought to my home, or even fruits and vegetables?
Right. For the fruits and vegetables, you're going to wash the fruits and vegetables, and soap and water is the best way to wash fruits and vegetables. You could consider, for example, if you have a package delivered and you want to bring it in and then maybe wipe it off with a sanitizer, you could consider gloves if you have those at home. One of the other things that almost all of us have at home are a whole bunch of plastic bags that we get from the grocery store. You could use 1 or 2 of these as a way to cover your hands. Bring the package in, then wipe it down with the sanitizer or with soap and water if that's what you have available. And that's especially important probably to think about with the cardboard boxes. You heard that the virus can stay on the cardboard box for a long period of time, so you probably do want to wipe it off. We don't know if those viruses that are there can infect you, but let's don't take the chance. And of course, after you do that, you always want to go back and wash your hands thoroughly again.
Right, hand washing seems to be our key phrase here, doesn't it? So another question for you, Dr. Yawn, is it safe to allow family and friends to visit who haven't been self-quarantining? And then what about children?
Well, I think there are always risks. And if you've got someone who has not been self-quarantining, I would try to figure out if I couldn't be Skyping or Facebooking or FaceTime or something else with them. If they do come in, again, before you let them in the house, make sure they're not having any symptoms. If they're having any, you say, thank you very much. Why don't you go home and call me? If they aren't having any symptoms and you feel comfortable that they would notice them, by all means, go ahead if you're comfortable with that, but keep that 6 feet away, that social distancing. Again, we've commented that the reason for the 6 feet is because if someone is coughing or sneezing and shedding the virus, it's unlikely it's going to be able to move 6 feet. So I think that's important. Now, children, that's a more difficult question, isn't it? Maybe it is a good idea to avoid children if they have not been self-quarantining, but a lot of children are being kept home by their families. And if they're self-quarantining and they aren't symptomatic, and they're your grandchildren, for example, I can certainly understand that you may choose to visit with them. But again, you want to suggest the children wash their hands before they, come closer to you. You can always do the interaction with them from a distance. It's a little harder with kids, we know, but you can try that. So just again, the common sense of trying to do what is the safest for prevention. If you are the caregiver for those children, if their parents need you to be their caregiver or you are the caregiver, then of course you're going to be around them and just use the good hand washing, keeping hands away from face and mouth.
Thank you. And I have one other question for you, Dr. Yawn. If I stay home, does my spouse or other caregiver that I live with need to stay home as well?
That would be the best idea, is if everyone in the house is self-quarantining and going out, of course, if you absolutely have to the grocery store and all those things, and maintaining your social distancing. So that's what we would like to do. If someone in your house is doing essential activities, then they are going to probably have to go out. It is likely if they're one of those essential workers, they are trying at work to maintain social distancing and doing other things to prevent the infection. So let's keep that in mind and do the best you can.
Great. Thank you. Dr. Thomashow, we've heard from some patients that say their spouse is in the hospital currently for a non-COVID related issue. Should they stay quarantined at home for a period of time upon release?
That's a good question. And I think when we have more testing, I think our experts suspect this group will get routinely tested. And since they'll be tested in a medical setting, I think we can be reasonably certain about the results. I would take precautions, including frequent and thorough hand washing, and if possible, keep them quarantined for 10 to 14 days. It's a good question, and there are no easy answers to all of these things.
Great, thank you. Many people have home care workers or healthcare workers in their homes. What precautions should they take before allowing a caregiver or a healthcare worker into their home?
So I think this comes back to some of the questions Barbara was asking. And similarly, I think you reach out to them before they even come to the door. And if they come to the door, you can ask the questions to the door. But I'd make absolutely sure that they haven't been sick, that they have symptoms, that there is no one at home or no one they've been exposed to who have symptoms. If they're okay, then ideally, I think they should probably wear clothes and wear gloves and avoid close contact with you while you're in the house. If they're helping with self-care, like bathing, make sure they wash their hands very well before helping. And you could consider asking that they wear a cover-up or change clothes if they've been to help others in their homes. It's a really good question, and one that I'm sure all of these people who you work with want to help you and be careful with you as well.
Great, thank you. So 2 more questions around preventing COVID-19 while at home. The first is, should I preventively request oxygen in case they get COVID-19?
You should only request oxygen if you're using it already and have a prescription from your doctor. Most people who have COVID-19 are not going to need oxygen. Some people with COPD who aren't on oxygen may potentially require it. You'll monitor your oxygen level and let your doctor know. Some people with COVID-19 and COPD who are already on oxygen may need more. That's certainly possible, and that too is to be discussed with the doctor. But I wouldn't rush to have oxygen if you don't have it already.
Thank you. And finally, how much medication should we prepare to have at home, and how would you go about getting coverage?
That's a great question. If you can get a 90-day supply of medicines, that would be safest. You'll need to talk to your insurance company to see if they make exceptions to the rules about medication supply limits. Many companies have waived their rules, and there is discussion in Congress to mandate that insurance companies allow for early refills and 90-day supplies. But I don't know whether the bill that's being looked at now includes that or not. Barbara, Jamie, do either one of you know?
Yes, hi. It currently does have some language requiring 90-day supplies, but we'll see if that ends up in the final bill.
I understand.
Thank you very much. Let's talk a little bit about preventing COVID-19 while out of the home. Dr. Yawn, should I wear gloves while I'm out?
Well, I think these are the kind of questions we get a lot of. Should I wear gloves? Should I wear a mask? And what kind of mask? So let me try to put those together. If you go out, it is fine to cover your hands with gloves, but remember, you don't need the kinds of gloves that healthcare workers need. You don't need latex gloves or the rubber gloves that they're using. You can use the disposable gloves that you may already have, or you can use even cotton gloves, and then when you get home, take them off and wash them, and then you can use them again. So that's gloves. As far as masks, the masks really are not recommended for anyone unless they're ill. The main point of a person that's not a healthcare professional wearing a mask is for you not to spread the infection to anybody else. It may help block the droplets if you cough or sneeze. Now, why do healthcare professionals wear masks if we say they're not appropriate for the general public? Well, it's because healthcare professionals have to get up close to people who may cough or sneeze on them or right in their face. And so they need this extra kind of protection. We can usually stay 6 feet away from people. We can do social distancing when we're out in public. Healthcare professionals and workers do not have this luxury or ability. So that's why they need a different kind of protection than we need. If you're going to wear a mask, the N95 is not really comfortable or easy for almost anybody with COPD to use or other respiratory problems. So I think you shouldn't even think about that. There are some new cotton masks that people are making at home. You can wear them if you choose, and when you get home, you throw it in the washing machine and get a fresh one if you go out again. So if you absolutely think you have to have one, I strongly urge you to get online and find the directions to make your own 100% cotton mask. But in general, they really are not recommended.
Thank you. I have another question about going out in public. Can I still go to work? Does the setting matter? For example, a warehouse versus a convenience store?
Well, right now, in pretty much every state, there are recommendations that as many people as possible should work from home. Many of the non-essential services like restaurants and other things are only open for takeout. So a lot of those workers are not going to work. Some people clearly need to go to work outside the home. Those are the essential workers. Most of the time, even in those particular jobs, if you are older and at risk with multiple comorbidities, your work site will ask you not to come to work and make sure that we do the safest possible indoor work in less crowded spaces. The better it is for everybody. So a warehouse where you don't work close to anybody is certainly better than a convenience store where you may have come face to face with many people every day.
Okay, and Dr. Yawn, I have one last question for you. Should I cancel elective or unnecessary medical appointments?
Well, I don't know if there's any unnecessary medical appointments, but for elective surgeries, yes, they should all be canceled. And the non-essential, you're getting a well checkup, you're just getting your routine check on something, those can be delayed. The other way to have those happen now is by telehealth. And there are more and more opportunities for people to be able to provide telehealth services to you for those more routine issues. And I would remind people, they keep thinking telehealth is one of those fancy things we have to do face to face. We've been doing telehealth for a very long time, and they were called telephone consultations. And so I strongly encourage you, if it can be done by telephone, do it by telephone.
Great, thank you. Dr. Thomashow, we'll turn to you for the next one, and that is, will using my oxygen in public increase the risk of contracting COVID-19?
No. And it is important to maintain your oxygen use as prescribed by your healthcare provider. There are some protections you can take to keep your oxygen equipment clean. I think these are important to remember. Regularly wipe down your tubing and cannula with alcohol pads. Use a fresh cannula when you leave the house and wipe it down when you return. Don't set your portable oxygen concentrator or tank down while you're out, if at all possible, and be sure to wipe it down with alcohol pads when you return. Make sure you wash your hands or you use sanitizer before touching your tubing or cannula, and bring an extra set of tubing in case your accidentally falls on the ground or another surface. I think all of those recommendations are important. They're on our website, along with some other advice.
Great, thank you. And just as a follow-up to mention to this question, for those who are looking for instructions around cleaning their oxygen cannulas and tubing, something that we're working on producing now, and that should be released in the coming weeks. And you can also find cleaning videos for your nebulizer equipment already on our video library on the website. Okay, so Dr. Thomashow, we're going to turn now to our last set of questions. These are some more general questions that came in. And the first one is, are there any recommendations for pregnant women?
Obviously an important question. From what we know right now, there doesn't seem to be anything to say that pregnant women are at higher risk than other people. There was some risk for pregnant women with the Sars outbreak back in the early 2000s, but from what we know right now, that doesn't seem to be the case here. There were a number of pregnancies that occurred in China during the height of their epidemic without any major problem. The one thing that we are seeing at my institution, and I'm sure a number of others, is that because of the risk of contagion, of people coming in who we don't know are infected or not, we're actually not beginning to allow a lot of people to come. So family members, spouses, they're not being allowed into the labor and delivery in a lot of places. That's not because we're trying to be cruel. It's because we're trying to be safe, and everyone needs to recognize that. Hopefully this will all pass, and once it passes, we'll be able to go back to life as we knew it before.
Thank you. The next question is, has there been any reason or research why COVID-19 has not affected the territories in Canada as it has in the US?
Well, there are parts of the United States as well where the incidence has been much lower. They tend to be areas where there are less people, more spread out. I think part of that is the Canadian situation as well. But Canada's done a very good job in encouraging social distancing and mandatory 2-week quarantine periods, probably a better job than we have done and started earlier. So I think there are probably a number of factors with it. This disease does not have a geographic limitation from the standpoint of where you live or who you are or what color you are or what your background is. This is a virus, and these viruses spread. They don't care what the human looks like.
Great, thank you. And the next question is, does the same advice that has been given to COPD patients here and on the webinar last week also apply to people with asthma, bronchiectasis, and NTM?
Well, you know, the answer is that the best advice is the advice we give to everybody. Clean your hands, do some social distancing, change your life a little bit over this period of time. We understand how difficult it is, but if we do these things, we can get through this together. That is the plan. We don't know enough to comment about all of these things. The sicker a person is, the more underlying medical problems that they have, the greater the risk they have that if they get infected, that they could have a more serious case. But everyone needs to take precautions. That's the world we live in now.
Great, thank you. We have just 2 more questions today. Dr. Thomashow, does COVID-19 cause lasting lung damage? And what other changes in the lungs can it cause, such as lung fibrosis?
It's too early to know. There is some evidence that short-term COVID-19 can lower lung function in people with underlying lung diseases. That's not unusual. People with COPD or other lung problems who have an exacerbation not related to COVID-19 can sometimes see a dip in their lung function. It's much too early to know whether or not there's long-term damage or not. The huge majority of these patients are going to get better and are going to get well.
Thank you, Dr. Thomashow. And we have one final question that was submitted, and that is, where can you find the coronavirus and COVID-19 information on the COPD Foundation website?
On the COPD Foundation site, look for Learn More tab, and then the section labeled coronavirus information. As Jamie can tell you, we're working very hard to provide as much information as we can. We are all in this together. And as you look for places to spend your time, COPD 360 Social is an important place. That's where a lot of our people are living now.
Wonderful. Thank you so much. And before we close out, Dr. Yawn, is there anything else you'd like to add to the discussion today?
Just to reemphasize that most of the work we're doing right now is to prevent people from spreading the virus and more people from getting it. Most of the cases are going to be mild to moderate, and we have a lot of work that's going on around the vaccines, potential medications, and just general knowledge about this virus. So stay tuned. What we know today is potentially going to be greatly expanded by a month from now and 6 months from now.
I agree.
Wonderful. Well, thank you both for taking the time to answer all of these questions today, and thank you for tuning in. As well as a reminder, the full list of questions, the written list of questions and answers received on the webinar can be found on the COPD Foundation's website. You can find that at the Learn More tab and look for coronavirus information. You can also link to it from the homepage towards the top of the page. So with that, we'll conclude, and thank you again to our experts for joining us.